Hi all, Namaste. Welcome to Drona and this is Dr. Jishnu Narayanan. In the last session of the same series, we have seen what is eczema and details about the atopic dermatitis. So in this series, we will see what are the conditions which we can include under the term eczema other than atopic dermatitis, and briefly about how well we can assess all these conditions through an Ayurvedic perspective. So let's see what we have here.
So, as we were discussing, other than atopic dermatitis, conditions like lichen simplex chronicus, these are also conditions of eczema where there is an itch rash cycle or itch scratch cycle. So, because of the history of continuous itch due to any reason, that specific area can go into a condition of lichen simplex chronicus. Repeated itch can cause lichenification of that area, and same like the history of atopy can be a underlying factor here also. So any kind of previous traumas or insect bites or these all can trigger the condition, and usually the itch will be more severe when the patient is in rest. The patient is not in contact or in what to say, in their busy schedule. So when the patient doesn't have anything else to be busy with, then at that period, either at night or when they are in the rest period, the feeling of itch will be very severe and the patient will be itching. That simultaneously causes the lichenification more, and it is a vicious cycle. So unless we stop that itch, we cannot actually treat the lichen simplex. So this is another condition, and we'll just go through most of the common conditions of the eczema. So stasis dermatitis or venous eczema is again a very important and common condition, usually happening over the malleolus areas, and it's a very, very acutely happening condition, even though the pathology will be there for a long time, but the condition actually worsens very abruptly. And osteototic eczema is another condition where usually the patients are very old-aged patients and their skin becomes too dry with pruritus. So it's a very common condition, but most of the time we miss the diagnosis, and the crisscross or crazy paving kind of marking over the skin, as you can see over the slide, is a peculiar sign of osteototic eczema. So numeral eczema again, or discoid eczema, is disc-shaped eczema happening usually over the lower legs, which usually goes into the stage of inflammation and infection very easily. So these are again a common diagnosis in OPD, and usually it happens in children, and impetigo or tinea infection. All these can be a misdiagnosis or rather difficult conditions to differentiate between. Again, dyshydrotic eczema or foamfolic eczema is a common condition which happens as a tiny watershed-like of symptoms over the palm or plantar area. And allergic or contact dermatitis, as you can see, because of any ornaments or chappal or even the bhaladaga kind of drugs, all these conditions can cause dermatitis, and this all comes under the heading of eczema. So now coming into the Ayurvedic perspective, even though modern diagnosis can be various and the prognosis can be different, in Ayurveda, the diagnosis basically starts from dosha. So as you can see in the slide, like the sloga what we have taken is from Charaka. So that just explains the different symptoms that happens to the patient of skin condition. So depending on these symptoms, we can actually classify the eczema into the specific dosha. So here, for an example, you can see here, there is an eczematous condition. It is an atopic dermatitis in the left side, and you can visualize the symptoms here. So it is ruksha. There is very tanu srava is there, very mild oozing you can perceive here. Kharatvam, parushatvam, and pitika, mild papillar lesions you can observe when closely observed. And Charmavadarana is nothing but just peeling off of the superficial layer, which you can see Arunata or Shyavata. So here on the right side, the picture over the toe area, you can actually visualize the Aruna Varna, and Shyava Varna you can visualize in the left side picture over the top area. So we can actually differentiate the Aruna Varna, the Shyava Varna, the Pitika. So all these conditions just gives us an idea that this can be mostly a Vataja variety of eczema. So coming to an example of Pittaja, even though we know that eczema, or for that matter any skin condition, is a Tridosha condition, but still for an example, we can actually differentiate between the Pradhana dosha. So here Pittaja variety of a Tridosha Kushta or a eczema, you can see here dark red color, Raga or Tamra Varna for that matter. Even though it is not visible, this was a case of severe oozing, Daha, and Pita and Sarakta Srava. So here you can see the Pita Varnada mildly, and Sarakta Srava, there is a bleeding spots are there and bleeding is there, and Tamra Varna, Daha, all these Pitaka, all these conditions can be seen. And Kandu, again, even though it is not a Pittaja Vigara, but Kandu becomes a mandatory condition in these varieties. So Kandu can be excluded, but otherwise you can see a very specific Pitta condition here. So here you can see in the sloka where Charaka explains as the symptoms of Paitika Kushta, Daha, Raga, Parisrava, Paka, Visrogandha, Kledasthada, Angapadanam cha Pittakrata. So this is very easily visualized here. Again, coming to the Kabhaja variety, you can see how evidently Kabha can be seen here. When you can touch the patient, the area will be Shita, there will be Kandu, Shaityam, as we have explained, Bahu Pichila Sravi. So here you can see this is a patient who is just coming after the Shalana treatment. So usually all the Pichila should have been removed off, but still you can see how Pichila the Srava is. It is Shweta Varna, whitish discharges you can see, Kleda is there. So all these conditions you can see. So this is, even though it is not a completely Kabhaja variety of eczema, but still you can visualize how Kabhaja variety can be presented as. So these are the ideas by which we can actually conclude, or we can come to a conclusion that which variety of dosha is associated in these eczemas. Coming to the involvement of dusha, we know that rasa, rakta, mamsa, lasiga, all these can be included or associated with kushta. So here also eczema can also be associated with these dushas, and it becomes a very important factor to finalize the treatment or to plan the treatment. So most important and most easy way of understanding which is the most prevalent dusha involved is to see the symptoms. Like if at all there is a visphoda, masurika, or small papule, maculopapular lesions are there, pitikas are there, then usually we can consider them as a vyadhi in the tvak or in the rasa. And in the rakta region, there will be visarpa and daha, fastly spreading and very severe redness over the area. When mamsa is involved, there will be paka and kodha. There will be inflammations, there will be infections happening. So all these can be visualized when the mamsa is involved. So even though there are a variety of names which we can come up, like Charmadala or the Vicharchiga or Kitibha or all other conditions of the names can be come up, that becomes a difficult task for the physician to come to a peculiar diagnosis and to treat, because we are left with no specific treatment for specific name of the disease, the kushta in Samhidas. Samhita explains the treatment with the involved dosha. So it is practically, it is easy and helpful for a physician to understand the pathology behind rather than going into the specific name. For the name, personally, I think the diagnosis of the eczema with modern terminologies will be an easy task, will be a practically helpful task, and understanding the pathology in terms of dusha and dosha will be an important one to come to a conclusion or the plan of the treatment in further. So, yeah, modern understanding and dosha dusha analysis and diagnosis of the samprapti. This becomes very important. So, in the next part of the slides, we will be dealing mostly in going in detail of how we can actually diagnose the samprapti and what are other factors coming other than dusha and dosha, and how we can assess the sama nirama of the condition in koshta and in kushta, and how we can manage it accordingly with formulation. We will be dealing it with these topics in the second part. So till then, thank you and keep supporting us. Thank you.
In the next session, we will be dealing about understanding the samprapti of eczema and how well we can make a protocol for treating the eczematous condition and few of the formulations what we use clinically to treat the condition. So till then, take care, bye, and thank you for watching.